Hello everyone, welcome back to my channel. So I was posted in the Hematology department at NRS Medical College and Hospital for 1 month, and we are posted here to learn basically the bone marrow procedures and reporting. So this is the reporting room where we have a penta head and the teachers and the faculties, they report slides and we also sit along with that, and we kind of corroborate the findings and learn ourselves. So every day we used to be present during the reporting along with the faculties and the SRs and the DMPDTs. This is the typing room where we used to type the reports of the patients because printed reports are being given to the patients. And this is the technical room where the slides are being stained and the other works are being done, like the machines are there to run the blood and etc. This is basically the flow cytometry area. So we mainly focused on learning the bone marrow procedure, where initially we have to position the patient, followed by infiltrating the lignocaine locally. And then here we did not wait for 2 to 5 minutes, which is usually the time which we are supposed to wait. But in RGK Medical College we used to wait for 7 minutes. But here, because of the rush of patients and of the huge number of bone marrows being done each day, we could not give much time to each patient, and then we punched in the bone marrow needle for aspiration, followed by the material being taken out, and then the smears were being done. So to see whether particles have come, and also to see like whether it's really a successful procedure or not. And then the slides were given for staining, and then after that we used to see the reporting done by the faculties and also see ourselves for screening. So the next procedure was to do the bone marrow biopsy, which was a much difficult procedure and requires much more strength. The PDTs who used to teach us and help us and guide us. And once the bone marrow biopsy material was being taken out, first we used to take imprint of that on bare slides, and then followed by putting it in the formalin and fixing it and then processing it into a histopathology slide. So that is exactly how it was done, and the aspiration actually gives more information, and then we corroborate the findings with the bone marrow biopsy. Here in each patient we used to do, almost in each patient we used to do bone marrow aspiration as well as biopsy, and there were so many various kinds of patients, but it was a very painful procedure to see and to do, and even there were small children who were doing it, and that wasn't a good scene to watch because it is a very painful procedure, and the lignocaine wasn't very effective. This is the doctor's room where we used to keep the bags and sometimes come for drinking water or having something. This is the room actually where we used to screen the slides ourselves, because we need to see the slides ourselves, and then in the morning when reporting will be done we used to corroborate our findings, and that's how we used to learn. This was the histopathology room at the hematology department, so I went there once and so I taken the clip. This was a seminar room where the classes used to take place, the presentations used to happen, where we also used to come to eat and have a lunch sometimes. So we also had to learn different kind of staining procedures in the department, like MPO staining, then PAS staining, then pearl staining. So the technicians used to help us. We also had to see the refer slides to see the low platelet count or whether blasts are present in peripheral smear. We also used to do the reticulocyte count over there. So this is how the posting came to an end. We learned a lot and enjoyed, and this was the last day where both of us were having ice cream. So I hope you enjoyed watching my video. If you like my content, then please consider subscribing. Thank you so much.